Hello, welcome to Microbiology Part 2 lecture. What all we have today is Campylobacter species. Campy selective agar at 35 degrees to 37 degrees and 42 degrees, 5% oxygen, 10% carbon dioxide, 85% nitrogen. Campylobacter jejuni and H. pylori difference is both are catalase and oxidase positive, whereas Campylobacter jejuni is urease negative and nitrate positive, epurate negative. Cephalothin is resistant, whereas H. pylori is urease positive, negative nitrate, negative epurate, sensitive to cephalothin and resistant to nalidic 6. Sensitivity is resistance. We have Streptococcus pneumonia is lancet-shaped gram-positive diplococci, middle-aged adults. We have Bacillus anthrax is bioagent category A. They are most harmful, highly infectious, mode of transmission, high mortality. Other category A bioagents are Bacillus anthrax, others are Francisella tularemia, smallpox, Clostridium botulism, Yersinia pestis, hemorrhagic fever, Ebola, Marburg or all we have got in the category A. We have the recent amoebic meningoencephalitis affected in Kerala. We have amoeba in CSF similar to monocytes in stained films. Naegleria fowleri and acanthemeba species, pseudopod mobility in a wet preparation and a pre-warmed slide. Then you have we have other we have hookworm or thin-walled outer shell, and they are unembryonated or partly embryonated. Then you have Ascaris eggs. Hookworm eggs are 60 to 75 microgram micro ml. I'll find out that. I will write it on the screen. Okay. Whereas you cannot differentiate necator and ankylostoma. Larger, clearer shell you have, whereas Ascaris shells, Ascaris ova are 50 to 75 this thing, that difference I will just write it down. And you have bile stained or large thick-walled, coarse corticated or Ascaris, and contracted embryo at opposing poles. You have fertilized egg in Ascaris. Okay. And Vipom megatrichuris are smaller and thicker walled, and threadworm hatch in the intestine and have rhabdiform larva in the feces. That's all you have for threadworm. And talking about pinworm and Enterobius, you have clear hyaline shell, flat on one side, visible larva within. You can have visible larva within, more elongated. Same otherwise that's all you have. Today we have anti-nuclear antibody for influenza A. Kits should be maintained at 2 degrees and -8 degrees. Disposing the kits depend on the manufacturing document for stability. And management objective. Management by objective is creative in work. Then you have enterovirus, viral meningitis 85%, viral culture is 50 to 75% days, you require days, and RT-PCR 95% you require hours. And the RT-PCR significant homology and the five dash, that is the uh, the chromosome level is 5, and using a significant primer, RT-PCR reaction is uh, not in RT-PCR reaction. That's all I have. Sorry for the limited virology part 2. When we come back. Thank you. I think the OVA, which is I was try to say, is 60 to 72 micrometers. Okay, this is the length, and 35 micrometer in the breadth. And cystosoma hematobium from urinary bladder, spine on one end, and adult trematode colonies, and blood vessels, colonizes in the blood vessels of urinary bladder. Egg is 150 to 60 micrometer, non-operculated, yellow, and from terminal spine. Thank you. Thanks for watching.